set the tone for what we're about to really dig into on this panel. And Dr. O, I wanted to start with you. You are one of the members of the President's Council. Can you just talk a little bit about what the current priorities are and sort of what the Council's overarching goal is?
Yeah, thank you, Emily, and thank you all for coming here today. Many people have probably heard of the President's Council, and historically, focusing on physical fitness has been one of our top priorities, and it is still one of the priorities. But what we've done is now we've recognized that nutrition is vitally important as well. And so making sure that every American has access to good nutrition, access to physical activity, those are sort of the primary tenets of what we're doing as the President's Council, making sure that every American is aware of the importance of those things and that we can then promote federal programs that then improve access to sports, fitness, and nutrition.
Just staying on nutrition for a minute, because you said that was one of the more recent ones. What are some of the biggest goals? I mean, why have we gotten to a point where nutrition really had to be added along with physical fitness? And what are the biggest obstacles in making sure that Americans have good nutrition and a good balance of things to eat?
Well, it starts really with what you put in. So as a physician, I see countless patients, and we now know that about twice the number of individuals in this country have diabetes now than just several years ago. And if we don't have access to good nutrition, then whatever you're doing, even physical activity, the beginning of that process is what you put in. And so when we don't have adequate access to healthy foods for our children, we can't expect them to be able to live healthy lives. And so focusing there on what we give our children to eat from when they're young is the type of thing that creates the practices and the beliefs that you carry with you as you get to an adult.
Brandon, I wanted to ask you a little bit about a partnership that the President's Council, they recently announced a set of historic partnerships, first of their kind, with every major sports league and players association in the country. Of course, the NBA is included in that. Can you talk a little bit about that partnership? What is that meant to do? Why is this sort of historic in terms of the Council's overall history?
Yeah, we are very proud to be partners of the Council, and we see ourselves as having a very unique role in this space, or a very unique opportunity is probably a better way to put it. I can say from my own childhood, if my mom told me to focus on something, if a teacher told me to focus on something, there's a good chance I would, but if Kobe Bryant said it, I was listening. So we really want to leverage that platform, that entryway into the hearts and mind of folks to bring some really important, critical messages like mental health, like nutrition, like wellness, so we can, create a better environment for young people to grow up and learn and play and be their best selves.
And how does this partnership actually work? Are you like sending kids like the NBA and like they're getting like lessons from like Stephen Curry and everyone, or?
So in a variety of ways, like we hosted, as the second gentleman mentioned, we hosted the second gentleman at our All-Star this past week, where we had, as well as the Surgeon General was at All-Star, where we, leveraged our platform to talk about these important messages, where we had a conversation called Newsmakers, where, it was Common, Asia Wilson, C.J. McCollum of the New Orleans Pelicans. It was moderated by Gil King to talk about these things, how they're affected in their personal lives, and how, these athletes, they seem invincible. They're huge. They fly through the air. With the size, speed, strength, it feels like, they're impenetrable. Nothing can get to them. But when they speak to these things on how the steps they have to take care of their own mental health, how they are affected by mental health, and how they keep up with their own wellness, it shows that this is something that affects everyone, and we all should take that step.
And Admiral Levine, of course, you oversee a giant swath of the work that HHS does when it comes to health and to mental health in particular. And I wanted to see if you could talk just for a minute about what HHS is doing right now on youth mental health, given that there's this completely new environment where kids are now online so much more.
Well, thank you very much for the opportunity to be here, and you're entirely correct. As the second gentleman had talked about, mental health is a crisis now, particularly among our youth. As we were talking beforehand, I'm a pediatrician, adolescent medicine specialist in academic medicine for many years before I was able to go into public service and public health. And so I know firsthand from my clinical experience how important it is about the intersection between physical health and mental health. And so this extension between fitness and physical activity and sports and nutrition and mental health is sort of an absolute natural fit. You know, mental health in our youth has been challenged even before the acute phase of the COVID-19 pandemic, but certainly the COVID-19 pandemic affected everyone, and it really impacted our youth. So now that we're out of the acute phase of the pandemic, we're still struggling with the mental health of our youth, as our great Surgeon General has been highlighting. So HHS under Secretary Becerra has been dedicated towards improving youth mental health. There are many programs under HRSA, under SAMHSA, and a whole alphabet soup of different divisions that we have at HHS that are concentrating on the workforce that the second gentleman was talking about, and then different programs to support youth. It is a really important time, however, to also mention SAMHSA's program of 988. 988, the suicide hotline. It's absolutely critical that everybody knows about that parents know, that youth know about 988.
Is it just like 911, pick up your phone, dial?
Dial 988. Of course, most kids don't use phones to dial. They text. And so you can text 988, you can chat 988, and you can get to trained counselors that can help young people and adults as well. And so very, very important to highlight that resource.
Can I also ask then, who should use 988? Like, if you begin having suicidal thoughts, it sounds like that would be a good number to call. But if you're just feeling maybe like really down, really depressed, you've never felt this low before, and it's been going on for a while, is that another good time to call 988?
Absolutely. I think 988 is a resource for mental health challenges, as well as for having overt suicidal thoughts. And so they can help connect you to local resources in order to help.
I did want to ask, since you do have the background as a pediatrician, I mean, how bad is it right now for kids who are growing up? I mean, I know to a certain extent, you know, bullying, teasing, that has always been something I think that, you know, a lot of us dealt with, whether you're online or not. But what does it mean now that so many kids have these social media profiles and that so much of what they're doing online is with these anonymous individuals?
I think that the impact upon the technology, and particularly social media, has significantly exacerbated, significantly made worse these mental health challenges, especially the issue of loneliness, which the Surgeon General emphasizes. There are some statistics that youth might spend, you know, less than 1 or 2 hours a day with other young people, and so really they're very concentrated on their phones, and it isolates them. And you'd like to think that social media might bring people together, but it's not really what happens for youth. And so that's why the sports, as emphasized by the President's Council, is so important, because sports naturally brings young people together, and that's why participation in sports is so important.
And Dr. O, I know that you yourself were an athlete, and I wanted to see if you could tell us a bit about your mental health journey, how you've navigated mental wellness as a student athlete, now as a physician, and just in the many roles that you've had throughout your life.
Oh, thanks, Emily. I will adjust the question a little bit and say that I am an athlete. And I'll talk about that, though, because we talk about access, right? And for those of you that can see me, I'm a wheelchair user. For those that can't see me, I'm a wheelchair user. When we don't have access to physical activity, then individuals don't get all the benefits that the second gentleman mentioned earlier. So if you imagine an individual in your community that's a wheelchair user, I want you to think about your community. Does that child have access to sports where they are? Now, this isn't to say that wheelchair users are the most important population, but I use that as an example of what a lack of access can look like. So yes, I was an academic All-American track and field athlete at Stanford before I did my medical school at Michigan. But in my third year of my orthopedic surgery residency at Yale, I experienced a spinal cord injury. And so that is why I am now a wheelchair user. Prior to that point, I did not recognize how inaccessible our world was and how inaccessible our healthcare system was. And so it was at that point that I told people I started to see life from the other side of the stethoscope. And so I now see how inaccessible our world is for a community that has a need. So if you use that community as an example for what type of access we need, without access to healthy nutrition, without access to physical activity, without access to an education, all of the benefits that the second gentleman mentioned will be lost. And so it is not that I focus my work now on the disability community because they're the most important, but it's because when we use the disability community as an example, it is ubiquitous. Disability does not discriminate based on race, gender, ethnicity, socioeconomic status. And I tell people that if you build with those that are most vulnerable in mind, then everyone has access. So I want you to picture this. There's a cartoon that I've seen used. Imagine that there's a school, and it snowed overnight. There's a set of stairs that all the students use to get in, and then there's a ramp over here. There's one child in that school that uses the ramp to get in. There are 500 kids using the stairs. The custodian starts shoveling off the stairs because, of course, 500 kids need to get into the building. But the wheelchair user says, "Sir, but if you shovel the ramp first, all of us can get in." So what types of programs can we create that build more literal and figurative ramps to give people access? So I know I didn't say much about what my work is, but now as a physician and as a physician who then runs disability services for the University of Michigan, my role is providing equitable access to the University of Michigan experience for every single student, whether that's their academic accommodations, whether it's testing accommodations, and then I'm proud to say that I'm the founding director of the Adaptive Sports and Fitness Program, which the second gentleman was in the Paralympic Games a few years ago, and I'm not sure if he plans on going again, but there is still sport for individuals with disabilities. There's the Special Olympics movement and the Paralympic movement, which are two parallel but important movements, one primarily focusing on individuals with intellectual impairment and one with physical. But all of these things lead to improving the mental health of the individuals that we serve. And so there are many, many facets of this world that we can then connect pieces to give access so that all of those benefits we mentioned are then felt by everyone.
And Dr. O, I asked Admiral Levine a little bit, I think, about kids, and I think maybe perhaps my question was targeted more at, sort of the elementary, middle school, high schoolers. You work with college students. And so I'm going to kind of pose a similar question to you. How have you seen just sort of the socialness, the atmosphere on college campuses shift the more online young people have become?
I think Admiral Levine hit it on the head. We think that this social media is meant to connect, and in ways it absolutely does, but it can be very isolating. So while I work with college students, I also have a 13-year-old son. And so I have this purview that I get to see every day of the transition that students are going through. When I was 13, I didn't have access to the internet in my hands. And the immediacy with which students are getting feedback now, which is not always positive, helps to contribute to that loneliness. And similarly at the college age. So I think that we can leverage technology and social media for good, but we have to recognize the damage that it can cause and make sure that we're not relying too much on that. But if we do use it, that we continue to pump out messages in those spaces. Because I know many, many people that learn a lot from TikTok and all these other social media channels. So if our children, if our youth are going to be on them, we need to also be meeting them where they are and putting good information in those spaces as well.
An example I was talking about with the Surgeon General is that when we were in college, back in the day, one of the biggest activities was dinner. You'd go to dinner, and there'd be a buzz of conversation at dinner, and with young people, college students studying many different things, talking about their studies, talking about their social life. You walk into the cafeteria now, it's pretty quiet, and everyone's on their phone. And it's just a very different experience. It's a very different social experience. And that would be an example of some of the challenges that young people face.
So, and I'll kind of open the floor for this question. What actually needs to be done? Because I know as a congressional reporter, I cover it from the regulatory perspective, and you see lawmakers say, we need these major social media companies to step up, and major social media companies will be like, well, the App Store should set up, and the App Store, and then there are folks who look at Congress and they're like, you're actually the one who needs to set certain regulations and parameters here. So I'm wondering from your on-the-ground experience, really what at the end of the day is going to make a difference for these young people in terms of how they use social media?
I think that it is incumbent upon the federal government, and we have a task force at HHS working on that, and it's really actually with other departments as well, looking at safety for young people on social media. And so I think it is incumbent upon the executive branch with the Congress to make sure that social media is safe, to try to limit misinformation, disinformation on social media. I don't think that the federal government is going to change the culture about that. I think that that really is going to need to involve all of us, not only in Washington, but in local areas, communities, to really try to help young people with sports and with other activities to be out there and interacting with their peers as opposed to just on their phones. I don't think that can just come from Washington.
And Brandon, I saw that you were about to respond as well.
Yeah, I talked a little bit about sort of the public messaging side, but on the infrastructure side, we have a program called Mind Health, which we started in 2018 that's led by Jamila Weidman, who runs our player development department, former WNBA player, Stanford Cardinal, and Dr. Kinza Gunter, clinical psychologist. And it's really to put that infrastructure in place for not only our players, but league personnel, so they have those safety nets in place, learning how to deal with things like stress, work-life balance, prioritization. Like life in the league is a very, very tumultuous and difficult thing, especially when you come into it. And we are very cognizant of this, especially for our young players. So before men or women in the W enter the league, during summer league, during their rookie transition, during something called Top 100 that we do for the top 100 prospects, are exposed to these practices and these tools that we have at the league. Each team has 1 to 2 mental health professionals on staff that are locally licensed and are accessible to each player and personnel on the team. There's a psychologist also in place, and we have year-round education programs to teach skills, but also what to do if you're in crisis and how to manage that. But also presenting that as all mental health is not a crisis. It's not illness. It's a spectrum of things. And having a deeper understanding and connectivity with that helps you better manage that going forward.
I also think that one thing that we need to do a better job of is destigmatizing mental health. Like, as you just mentioned, when we talk about mental health, I think that people often think about the negative side of mental health, right? We think about something that's illness. We think about negative. We think about loss or lack of, right? But I think that mental health encompasses all of that. And so we also should promote messages about good mental health and positive mental health. This gets back to sort of another thing I talk about often, which is that we see disability as a 4-letter word. And mental illness is something that people see as a deficit mindset, rather than seeing it just as sort of the spectrum of human experience that we all have. And especially for our youth, when they then see or hear that they have an illness, it's stigmatizing. It makes them feel othered. It makes them feel different, right? I'm not ashamed to say my 13-year-old son has a therapist, and he talks about seeing his therapist. And I think that when we destigmatize mental health and we normalize conversations around it, we then don't separate people and make them feel othered. So I think that's something we can do with social media as well.
Can you give sort of an example of a positive message, or like reframing mental health in a positive way? Because I do think sometimes when people hear the terms mental health, they quickly think of those who have a mental illness and need, either be it prescription medication or therapy to overcome it. So what's like a positive way to do? And I'll ask Dr. O first because he mentioned it, and Admiral, I'm happy to come to you next.
Yes, I'll actually say that I think that what we need to do is to even destigmatize the fact that someone may take a medication, right? I don't want to separate that to say there's mental health here, and then there are those that take medicine and they're different. Those that take medicine, those that use wheelchairs, those that are blind and low vision or deaf and hard of hearing, have anxiety, depression, bipolar, they are no different than anyone else. And I think that by normalizing the conversation to let people know that in this audience, I can guarantee you there are certain individuals that may be taking psychiatric medication. You can't necessarily see them in the room because they don't say it on their chest like a scarlet letter. But I think by talking about that, by making sure people know numbers such as 988, by making sure that we then have programs like the Move Your Way campaign that we have at the President's Council so kids can see ways to get out and get active. I don't think that we're going to eliminate the negative aspects of mental illness. But by capitalizing on the resources that we have, like the National Youth Sports Strategy Champions, and promoting those things on social media it will give young people an opportunity to then see themselves. When we have partnerships with the NBA and some of the NBA athletes and WNBA athletes talk about their own mental health journey, I think, once again, it will normalize things. I don't think we can eliminate the negative aspects of mental health, but I think by sort of pushing up the positive things that we can help counter that, I think that's an approach.
Well, I agree with Dr. O completely, and I think that that we need to destigmatize the issue in terms of mental health and challenges to mental health, and I think that's critically important. But I also think it's important to kind of view it as wellness, not only physical wellness. We've been talking about physical activity, talking about nutrition, but also mental health wellness. A metaphor that I've often used in young people in talking with groups is the eye of the hurricane. Right, so we had storms there've been tremendous storms over much of the country, and we're entering hurricane season. Well, and the winds of the hurricane are very, very strong, and that's sort of a metaphor for our lives, which are stressful. Right, we all have stress. Young people have stress. But in the eye of the hurricane, it's quiet, and it's calm, and it's peaceful. And so we need to help young people find something to help center themselves. And so that's different for every person, different for every young person. It might be physical activity. It might be sports. It might be art. It might be music. It might be their faith. It might be their pet. But something that centers them, and I think everybody needs to find that, and every young person needs to find that for themselves.
Something I can throw in on that is, we hear these anecdotes about, players like LeBron James spend $1 million a year on their body, on their physical health. Leading up to games, leading up to seasons, there's massages, there's stretching, there's strength, there's cryo, there's all sorts of things. That same focus, that same prioritization should be put on your mental health. And it's not just, I have this injury. It's your constant maintenance and preparation for daily life, not just the game, but your daily life, and looking at it that same way, that same level of preparation.
And Brandon, I did want to ask you a little bit, because you do work with these NBA players who are just incredibly well-known, absolute household names. Can you talk a little bit about how they should be using their platform to normalize mental health stigma and communicate with young people about wellness?
Yeah, I think we have a number of players across both leagues doing a phenomenal job at this. DeMar DeRozan of the Chicago Bulls is very eloquent, has written about this, has spoken in videos and PSAs. Shamika Hosklaw, similarly, Kevin Love, talking about this from their personal experience. Like, everyone's experience is different and unique in their own way. But, it's not absent from any of us. Like, we all have something that, we should take care of in our own lives. And players speaking authentically to that makes it feel okay, especially for younger people, to really wrestle with that and deal with it in their own way.
And Brandon, I also wanted to see if you could just talk for a little bit. Working with the NBA, I often think of them as, physical activity, but you also did mention that, there are folks there on each team to try and take care of the mental well-being of the players. And I'm wondering if you could just talk about the NBA's history with that, of really making sure there is a focus on the mental as well as the physical. Yes.
So as I mentioned before, we try to put the same weight on both, that same investment, that same prioritization. And in 2017, we worked with the Players Association to really set standards in place so there's consistency across the board for every team to have those resources available for players. So in 2017, those what we call requirements and recommendations, we put them together and they went out. They now go out on an annual basis. And then in 2018, Mind Health was developed. And Mind Health was really to really put all of that work under one umbrella in partnership with the Players Association and really focus it around three things. First, it's humanizing mental health, talking about it in a normal way, like it is something that is an everyday occurrence. And then humanizing, honoring that lived experience that I talked about before, and then elevating your participation within that. So folks can see that, while it may be stigmatized in some places, it is something that is crucial to my success as a player and can be crucial to your success in whatever arena you may bring it to, or just getting along day to day. And that's really how we've done it. And our players have really embraced that, which, is really great for me to see personally, because it helps folks who might not want to engage with this or might, have some sort of apprehension to give it that second thought.
And Dr. O, I know we touched a little bit about COVID-19 and the impacts that it has, but I wanted to kind of ask you the question directly as someone who sits on the President's Council for Fitness and Sports and Nutrition. Have you guys had to sort of change the mindset or the focus of the council in light of the after effects of COVID-19?
I think Admiral Levine touched on it when she said that what COVID did was it exacerbated things that already existed, right? And so this mental health crisis, worse, right? Access to physical activity, worse. And so I think that one of the things that we can use to talk about the partnerships, while it's great for these NBA, WNBA, MLB players to use their platforms to get these messages out, I think that coupling it with the work of the President's Council is wonderful, because one of the things that they're also doing is they're helping to amplify some of these federal programs that exist. Because while LeBron can get on TV and say something, if that child doesn't know what resources exist in their community, then they're not going to have access. So that's one of the things that the President's Council that we're most proud of, is that what we're going to be able to do together is then amplify this message, but by then making sure people are aware of federal programs that they may not have known, provide better access to them in their communities as well.
Is there any particular one? Like, I'm thinking 988 was a great thing to remind folks about and make sure they know that exists. Are there any programs that the council has that you feel do not get the attention they deserve and are worthy of a shout out now so people know about them?
One that I mentioned already, the National Youth Sports Strategy. So to become a National Youth Sports Strategy champion, you then get a toolkit that allows you to be able to then promote the programs that then you do. So to become one of these, you apply, and it's not like there's some complicated application process, but what it does is it elevates these grassroots programs wherever they are who are already providing access, but people may not know that those programs exist. And so by becoming a National Youth Sports Strategy champion, what we're doing is not reinventing the wheel. We're merely elevating the work of people in the communities that are already doing it. And there's also, as we speak right now, we have some awards that are coming from the President's Council that will also give people an opportunity to demonstrate their leadership in the community and the programs that they've built. And so I think that we have wonderful things that exist already, but awareness is sometimes the problem. And so I think these historic partnerships and the work of the council and all of the work that Admiral Levine does through her office, I think are helping to then promote that.
And Admiral Levine, I wanted to ask a little bit, because you do have, of course, the Olympics and the Paralympics that are coming up. I'm just wondering if we can expect anything from HHS or even wider the President's Council trying to have some awareness for mental health, mental wellness coming around that time.
Well, there will be activities of the President's Council during that time highlighting those amazing events. And we're just really so thrilled and excited by the work of the President's Council with Dr. O, the co-chairs, Elena Deladon, and Chef Jose Andres, and all of the different members, some of whom are here, who are just doing so much work both in Washington, but actually locally as well, because of course they come from throughout the country, highlighting these critical issues, highlighting the importance of physical health and mental health, the importance of nutrition in terms of food security and nutrition security, and the parallel work in terms of food as medicine. And so when we have great events like the Olympics and the Paralympics, then it just highlights all of these different issues.
Brandon, I know we've also seen more athletes, kind of you mentioned this, that have become a little bit more vocal about the struggles that they have had with the mental struggles that they've had, the issues. I feel like during the last Olympics, a lot of us, we watched Simone Biles kind of say, hey, I'm not in the headspace, and forgive me if this is not the best term to be using at this moment, but she had something where she had to step back, she had to reassess, and then she kind of had to make that call for her own health and her own safety. I'm wondering if you're seeing more athletes begin to talk about things like that, and if there's a particular reason why we're seeing that shift now.
I think folks are definitely getting more comfortable doing that, having, some of the guys I mentioned earlier show that leadership and that you can do that and it's okay. It's not going to affect your career. It's not going to affect, your endorsements or how people see you, that you could talk about these things in a human way and it's going to benefit a large group of people. And then, we have this partnership that gives us access to these experts where we can make sure they're getting the right resources and materials, not only for themselves, but that they can go and talk about and discuss in public forums. So we've housed all of that under NBA Mind Health. If you put NBA Mind Health into Google or your social search bar, you'll see those things, and you'll see different players from the NBA and WNBA talking about their own personal journeys. And, you know, it's really encouraging to see that continue to grow, not only in our league, but all across sports.
I know, obviously, there's been a lot of promotion about sports, but I know there's also been a number of headlines in recent years about sports injuries, particularly concussions, and the impact that that has had on players, both in the moment and then going forward for their adult lives. I know it's been studied by the NCAA, the professional leagues, and I just wanted to see, and Dr. I'll come to you first if you don't mind, since you are currently at a university. Has there been anything the council has done with interacting with sort of these kind of issues as far as the injuries and the concussions and what needs to be done to make sure that those who play sports can remain safe?
Absolutely. I'd say that the President's Council is a federal advisory council. So while we as the council ourselves have not necessarily engaged in something directly, we do amplify the work of others. And so there's a lot of work that's been done around safe sport and safe play. And we have sort of worked with other individuals to try to make sure that there's something called safe sport that we all need to do. And I don't want to call out any specific institution's work necessarily, but I may be very familiar with one that does some work around concussion prevention and concussion work. So I think that the council, once again, helps to then amplify work that is being done in other spaces. But I will be more direct and say I don't know of right now of a specific initiative that we are working on with respect to concussions, but I know that we have organizations that are doing concussion work themselves, and we are amplifying those organizations in general.
Sure. And Admiral, I know we talked a little bit about social media, but I know also the Biden administration has turned to social media and social media influencers in order to get out certain messages that they have and trying to be able to promote certain things that they are doing with the government. And I'm wondering if there has been any consideration to, you know, using some of those most loudest voices on social media, maybe not necessarily athletes, but people who the youth follow and pay attention to, and be able to use that to kind of get out some of the messages about some of the mental health impacts social media can have.
So there are, of course, social media platforms that are used by the White House. There are other platforms used by HHS and other departments, including for the President's Council. Primarily, we rely upon X, which is formerly known as Twitter. Is that what we say now? Yep. But there are different platforms where we try to get our message out because we know that young people and adults are using social media platforms, and so we want to be there so that they can to highlight the great work that the President's Council is doing and that we're doing across HHS.
How do you think about crafting those messages where it's sort of like, hey, you're on social media, get off social media, have a good day?
Well, so it isn't that social media inherently is bad. It's a tool. It's a platform. And so we don't want people to only be on social media. We want young people to be playing sports, of course, to be in school, to be doing other activities, and to be interacting with their peers. But we know that young people are on social media, their parents are on social media, and it exists. It's not going to go away. And so even though there are recommendations that make sure that it's safe, that there are regulations that it's safe, we're going to use the tools that we have in order to get our message across.
And I'll also, sorry, Dr. I
was just going to say that one thing that at the President's Council, to piggyback on that, we talk about the fact that physical activity can come in many, many forms. So while we talk about sports today and we think that sports are one way, dance is a form of physical activity. Sure. Right? Getting out and walking your dog is a form of physical activity. So the President's Council put essentially a combination of videos together for our Move Your Way campaign, where we talked about the way that we move, to show students, to show anyone that it doesn't have to be an organized team sport. It doesn't have to be going outside and running. But if you're already on social media and you're going to be seeing this, we want people to see that being active is any form of activity. And so encouraging people to do whatever it is, if it's bachata, if it's tap dance, if it's swing, if it's running, if it's tennis, if it's wheelchair basketball, wheelchair rugby, whatever it is that you're doing. And I think that that's where we're trying to leverage that social media platform to then get those types of messages out, so that the historic way that we think about physical activity is not what we're limiting it to, but showing people that you can be, even esports now, people playing these video games, that they're more active in the way they're playing the video game than we used to be back in the day. Even those things are a way to get students to know they can be active.
And for students, I mean, have we seen, are there any particular trends that have come with how many kids are playing sports, or on teams, or on dance teams, or on cheer teams, or doing things that could qualify as physical activity? Is there any, I'm curious, is there any sort of data as to how, if that has changed over time?
I know that obviously with the acute phase of the pandemic, there were challenges with that, and I think that it's coming back. I don't have specific data at my fingertips.
Okay, so maybe like sports playing dropped off, but now people are beginning to get back into being on teams.
Yes.
Feeling more comfortable being less than 6 feet apart from their peers. Yes. Interesting.
I would say that if my son's sports calendar is any example of other teenage parents, we are always at some travel soccer game or travel baseball game. And I will say that our country is actually doing a much better job of youth sport, because I think back when I played youth soccer, there weren't as many opportunities to play. And while at some end we're starting to professionalize youth sport a little bit, which I have my own thoughts on, but I do see a lot more opportunities for kids to be able to play, and a lot more sports that they can play as well.
Yeah.
So
I'm actually kind of interested in that, because I remember kids growing up where it kind of felt like they had a part-time job as like an amateur athlete. You know, they were going so many places and doing so many things. And I am kind of curious on what your thoughts are. If you're trying to sell the idea that sports is an accessible thing that is healthy and good for everyone, how do you sort of mesh that with these very, very intense time commitment sports teams and leagues?
You know, I think that starts at home as well. So just ironically, timing-wise, today, on my way here, I got an email because my son's soccer season is wrapping up. They're about to have tryouts for the next year. There's something called Elite 64, which is like a national travel soccer. Now, my son plays multiple sports. You don't want to, as you said, overdo anything in one particular sport. But I think that at home, whether that's with your mom, your dad, your uncle, your moms, your dads, whoever your family unit is, having a conversation about what is reasonable for you and making sure that the child is centered in that conversation. So it's not overbearing parents forcing them to do something, but the child being able to have some autonomy to choose what level of play they want to have. So I think that it can go to an extreme, but making sure that you're having a conversation and including the child in the conversation, it doesn't mean you let them make every single decision, but at least they're feeling like they're involved in being able to sort of participate, almost like a choose your own adventure story, to say how much of this do they want, while having the adults in the room making sure that they're keeping an eye on it.
Absolutely. I also know that in recent years, sports gambling has become something that is now legal in a number of states, more widely accepted, and you're seeing more individuals get involved with. Of course, you know, gambling can be perfectly fun and harmless activity. It can also be very addictive, and it can lead a lot of people to get themselves and their families into very, very bad spaces. And I'm wondering, and I'll come to you, but feel free to weigh in. Is there anything that the HHS is specifically doing when it comes to sports gambling and types of addiction?
I know that SAMHSA has some resources for people who have gambling addiction, and it hasn't been probably a priority for HHS, but I know that there are some SAMHSA resources.
I don't know if you guys had anything to add on that one, or.
Yeah, I mean, it's something we certainly pay close attention to. We invest a number of resources in making sure folks have access to responsible gaming resources. We both do PSAs throughout the year, make it available on our website. We have partnerships with the National Council on Problem Gaming to make sure that we're amplifying their messaging as well. And we also put limits on the amount of advertising that you see in arenas and on television. Mm-hmm. So it's something we are definitely aware of and doing our best to play our part.
I'd say as a family medicine physician, I'd take this opportunity to highlight the fact that we mentioned addiction. These addictions are not just someone being a bad person. So reflecting on the fact that your primary care provider, your physician that you see, is someone who you can talk to about this. This goes back to destigmatizing mental health, destigmatizing mental illness by making sure people know that you can speak to your physician about this if you feel as though gambling has become a problem, or if someone in your family has said that gambling is a problem, to make sure that we're not sort of ostracizing individuals who identify as having that as a struggle, and making sure that the resources that exist within your community, such as your family medicine physician, are something that you're aware of as well.
We also got a question, I think, Doctor, I'm going to have to throw this one to you. It says, many who participated in the President's Council programs in years past remember getting patches, pins, and certificates when they had logged the required time or mileage. Do these programs and incentives still exist in a digital age?
So I would say that what many people refer to that they know is, you probably remember PE when you were a kid, and you had that, presidential fitness test that we had to do. Now, I think that I can be comfortable saying that the President's Council over the years has recognized that while the goal of that was to encourage physical activity, what it started to do for some was it started to make some people feel as though they weren't achieving. And so I think that the programs that we do have these programs that we're elevating, such as the National Youth Sports Strategy. That is something that you do get these digital badges. You get the toolkit that I mentioned earlier. So that's probably the closest reflection of what that previous iteration was that you can think of. But we also have wonderful council members that are here with you as well, and they are working to then make sure that the programs that exist in their communities with the expertise that exists is something that the President's Council is amplifying. We as individuals are not promoting our own work, but we're promoting work in our communities that having this council of folks that I'm in awe of every time I see them is just a wonderful opportunity as a nation to start to get some of this information out.
And we're just in the last couple minutes of this event, but I did want to actually take a minute and ask those in the council if they could just stand up for a minute, let everyone see who you are, be recognized. Thank you for letting me put you on the spot like that. I appreciate it. All right, before I ask the final question, just let me take a moment to thank the organizers of today's event, headliners, team co-leaders, Donna Limewand-Legere, Lori Russo, and Jen Judson, today's headliner event coordinator, Kevin Wensing, today's Washington program manager, Cecily Scott Martin, club membership director, Kate Helster, and club executive director, Didier Soji. It is also my honor to present each of you with the much-coveted National Press Club mug that's been given to ambassadors, very famous people, public officials. We hope that you drink many cups of coffee from it / the alcoholic beverage of your choosing. All right, and now for our final question, and we'll just go each in turn, starting with you, Admiral. With your busy schedules, what is your secret to staying fit, both physically and mentally sharp?
Well, as I mentioned, I think that it's important for all of us to have some activity in which we can center ourselves to deal with the stress that all of us face in life, both in our personal and professional lives. So for me, I will either go for a walk, or I'll swim, or I'll do a bike, and keep myself centered the best I can given the schedules that we have.
Brandon?
Well, I mean, it might be obvious, but I still hoop as much as I can. You see the shoes, I'm always ready if anybody wants to smoke. But, I try to play as much ball as I can, and, try to filter in some exercise into normal day activities. Like if the store's 2 blocks away from my house, like I'll try to walk as much as and avoid driving, or do things that, I can walk to or have some physical activity involved instead of the latter.
And Dr. O, I know you mentioned at the start that you are still an athlete, so I know you've got a good answer to this.
Well, I try to do my best. Now, I don't stay as active as I should, but that's another story. But adaptive sports are sports that we've been trying to promote, sports like wheelchair basketball, wheelchair tennis. And we tell people that adaptive sports aren't sports for people with disabilities. They're merely sports that are more accessible to and inclusive of everyone. So since my man here asked if anybody wants some smoke, on the record, I'm going to challenge him to play some wheelchair basketball because it is
accepted. Accepted.
It is a sport that keeps everyone active, but we tell people just like he's got on a pair of shoes to play basketball, being in a sport chair is not being in a medical device. It's a piece of sporting equipment that anyone can use. So if we then have every local YMCA offering wheelchair basketball for everyone in the community, that one child who wasn't able to get in because the snow wasn't being shoveled from the ramp will have a team of individuals playing sports with them. So playing adaptive sports and keeping up with my 13-year-old is the way I stay physically fit. And training to take him down.
All right. Well, we will look forward to that particular matchup. And thank you guys all so much. Thank you to our fantastic panel for being here. And thank you to everyone in the audience for being great participants and all the great questions. Thank you so much.
Hey, let's do it.